sorry if I bore you to tears. Hopefully at least everybody will get, one thing out of it. That would be great. But, so maybe this is brand new to you, and that would be great. I hope to be able to teach you something here today. So, normally I cover this on the first day of class, but we're so limited with classroom time, so I thought I would save some, that valuable classroom time and basically put this online so you can do it on your own time. So let's go ahead and get started. Okay, so first, what is biomechanics? So again, I don't want to waste your valuable time, but let's just go ahead and read through this kind of quickly. So the definition from NASM, which is the National Academy of Sports Medicine. If you're interested in doing personal training, I encourage you to get to know who NASM is. Very reputable organization. But anyway, okay, so the definition of biomechanics is the science concerned with the internal and external forces acting on the human body and the effects produced by these forces, or the study of applying laws of mechanics and physics to determine how forces affect human movement. So basically, just to sum it up, it's basically analyzing how the human body moves. So why do we care? I know, as a part of your college career, you take a lot of classes like Intro to Chemistry and Physics. Maybe that physics is valuable after all. But anyway, biomechanics, I think, is so incredibly valuable if you're going into, wanting to be a personal trainer, physical therapist, a strength coach, PE teacher. I mean, you will use this information every day that you go to work. So why, or I guess how, would be the right question. So, for example, let's say that you're a personal trainer or a strength coach, and somebody approaches you and they want to hire you, and they are, let's say, a softball pitcher, or maybe they play for the national team from Canada for curling, and you have never even seen curling before. So does that mean you have to turn them away? Absolutely not. So all you have to do is just go ahead and, learn what curling is. All you have to do is just look at some video. It'll just take you a few seconds, really. Just look at some video of somebody, doing the motions that your client does. And then all you'll have to do, if you can look at those motions, then hopefully by the end of today you'll be able to analyze, what's going on, what movements are happening at what joints. And if you know what movements are happening, then it is black and white. You know what muscles are working, although sometimes it's gray. But anyway, so you know what muscles you need to train. That way, you train those muscles. You can make them stronger, faster, more enduring, whatever the case might be. And then you have a very happy client. So like I said, you just go online or however, just look up, and I encourage you to learn from the experts, the people who are technically the best at that sport or in that field. Learn from them what the motion is supposed to look like. Like, for example, don't look up how to swing a golf club from Charles Barkley. If you have never seen that, then I encourage you, after this video is over, I was going to embed it here, but then thought, no, I'm not going to waste your time. But if you haven't seen Charles Barkley golfing, you got to go watch. But anyway, so you look up and, learn from the experts what the motion is supposed to look like. And I would also say, watch your client do it as well, because, your client doesn't necessarily do it the same as, all the other quote-unquote best athletes or, experts at that. Like for example, maybe your client or potential client is a pitcher for baseball. Well, maybe you look up some of the best pitchers, but maybe your client is a sidearm pitcher, and that's very different from, doing the regular, overhand pitching like they, for, anyway, in baseball. So, like I said, just because your client, does it differently, that doesn't make it bad or wrong. So, you do want to make sure to watch your client actually do it and see what motions your client's doing, and, train them the way that they do those motions. But anyway, okay, so that's one example. Is you could, train a professional athlete and never have played that sport before yourself. And that doesn't matter. You can still be an excellent trainer or strength coach to somebody who plays a sport that you never have. Okay, so another thing that hopefully you can do by the end of this video, if I do a good job here, is you can go into any gym in any, country, even, in the world, and look at the machines and be able to analyze, does this machine do what it says it does? Like, we'll take a look at, the chest press machine today. And sometimes a chest press machine doesn't really work the chest very much. And you'll be able to look at machines and be able to make that determination or not. Or let's say, you're working with a client and they say, hey, you're in the middle of a gym. Hey, what's that person doing over there? What's that exercise? What are they working? And you can, look over at that person and look back at your client and say they are doing absolutely nothing, because that exercise that they're doing isn't doing what they think it's doing. It's pretty much not worth it. But you'll be able to know that stuff, hopefully, again, by the end of this today. So be able to analyze basically all different exercises and know, machines, are they worth our time too? And hey, maybe you could even, go work for Hammer Strength, work for Life Fitness, and make us some even better resistance training machines. That'd be great. Or you'll be able to, if somebody comes up to you and says, oh, you're a trainer, oh, hey, what's the difference between a wide grip and a close grip pull-up? You'll be able to answer that question, hopefully, by the end of today. Or, again, we're going to look at the chest press machine for sure. So what's the difference between doing, the horizontal versus the vertical handles on the chest press machine? You'll be able to give them a very intelligent answer. Okay, again, only if I do a good job. So let's see if I can do that. Okay, so I think the best place to start when you're learning biomechanics is with planes. And I know if you've taken a class before where you've learned some of this, then you're probably groaning right now, like, oh no, not this again. And maybe you're saying that because it really didn't make sense to you before. So I'm going to try to explain this hopefully in a way that this really makes sense and you can use it, which that would be the best thing. Okay, so basically you can divide motions that the human body makes into 3 different planes. So planes of motion. So let's go ahead and just take a look at one of them. So the frontal plane. So I know this picture isn't great, so I apologize for that. But okay, so the frontal plane is the one that's in the middle. So the guy who's, standing there with the pink box around him. So that's the frontal plane. So it's basically dividing that person's body into the front and the back sections, or you could call it, the more like official words are anterior, meaning front, or posterior, meaning back. So basically we're dividing that body into, the front or the anterior portion and the back or the posterior portion. So basically that frontal plane is just the way it is now with that pink box is, directly in the center of that person. And, everything, kind of in the right is the front part or the anterior portion. And then, we kind of can't see so well the pink shaded part of that body. That's the posterior section of that person's body. Okay, we can move in the frontal plane. So, picture instead of just that pink, basically it's like a flat, rectangle. So instead, pretend like it's a box. I always like to say it's like the box for the biggest flat screen TV you've ever seen before. So it's like a very tall but kind of skinny box. So let's say this guy, who in our picture has the pink shading, he is now standing with like a cutout inside that box. Okay, so if you pretend like he can move his arms, like he can fit his arms inside that box, and so let's make him do like jumping jack arms. So he can move his arms up and down, and he's moving inside that box. Okay, so that would be movement He's standing there. He's doing jumping jacks, with his arms. And his arms are actually sliding inside that box. And that is movement in the frontal plane. Okay, so hold that thought. Okay, so the second plane that we'll look at is the sagittal plane. So that's the one in blue that's off on the right-hand side on this picture. And again, I know it's a terrible picture. Okay, so the sagittal plane is basically cutting the body into, the left and the right sides. So if you can imagine, again, we have this, big blue rectangle. It's basically going through the middle of that person's body, like basically right through their nose and out their back. And it's cutting them into like the left and right sides. Again, I like to use that image of the box, which I hope it's helping. It's probably making it worse. But so now you can move inside that box if we have it positioned that way. But now keep in mind that the sagittal plane does not have to be right exactly in the center of the person's body like it's shown in this picture. So we can take that sagittal plane or that blue, rectangle and go ahead and move it to either side. And so now let's say we have that box and we're positioning the box, basically right going through the person's shoulder, let's say. Okay, so now if he moves his hands forward, he can move his whole arm inside that box, going in front and then in back, front and in back. So like if you were walking, you're swinging your arms. So that, that could happen inside that box if we move it over to the shoulder. And that would be movement in the sagittal plane. Okay, I hope that makes sense. But and like I said, it doesn't have to be exactly in the center like they're showing it. But when it is, by the way, and this is just like an FYI, so like before with the frontal plane, it was like anterior and posterior. So the sagittal plane kind of divides the body again to left and right. We use those words all the time, left arm, right arm. But the closer you are to the actual sagittal plane, that's considered like the midline of the body. Although I don't want to get too confusing because we'll use the midline of the body for a different plane. But so it basically, so if you're close to the sagittal plane, that's like the midline, and then the farther and farther away you get from that exact, halfway sagittal plane, then it would be considered like distal, so like farther away, like down your arm, like down to your fingertips. That would be considered distal because it's farther away from the middle part of your body. But okay, so again, let's go ahead and hold that thought. Alright, our last plane is the transverse plane. So that's the one on the left in our picture, so the green one. So if again you see where it is positioned right now, it's dividing this person into basically like the top, which is the superior portion of the body, and the bottom, which is the inferior portion of the body. So again, we can pretend that that green rectangle, it has some, thickness to it, and it's a box, and we can actually move inside that box. So again, just like the sagittal plane, the transverse plane does not have to be exactly in the center of that person's body. We can move it again up, to their shoulder height. So now we have that green thing. Just kind of picture it just lining up that person's body. And now it's at their shoulder height. So now if they basically do, movement inside that box, like big claps in front of you, with straight arms, if you clapped your arms in front of you, straight out at your shoulders, that would be movement in the transverse plane. Okay, or you can also move it down to the hips, so there can be movement in the hips, like you can move your legs in the transverse plane. So it would be really awkward, but exact movement in the transverse plane would be like if you were standing up and you stuck your legs straight out, just did like a straight leg lift to the front, and then from there you basically swung your leg from side to side, from in front of you, around to the side, and then back in front. That would be movement in the transverse plane. Not the easiest movement to do, not that common, but that would be movement in the transverse plane. Okay, I hope that makes sense. So let's go ahead and, hold all those thoughts. We've been holding all those thoughts. Let's go ahead and start and see why this is important information. So now that we know the different planes of motion that can occur for the human body, we're going to use those planes to start naming some of the specific movements that the human body makes. So first of all, like I said, we're only going to do some of them. There's plenty more than what we'll do today, but we're not going to do dorsiflexion and plantar flexion and stuff like that. In fact, we're just going to do the 6 major ones. Okay, so we have the planes. We're going to use the planes to describe specific motions. And the nice thing is once we know what motion's going on, we know, because it's always black and white, although sometimes it's gray, we know what muscle is doing that motion. Okay, so flexion is a movement resulting in a decrease of the joint angle, usually moving anteriorly in the sagittal plane. Okay, so let's go ahead and break that apart. So movement resulting in a decrease of the joint angle. Okay, so I hate that the definition for flexion says a decrease in the joint angle. But since it says that, we're going to go with it. I wish it said increase, but okay. So if you imagine back to the picture with the guy in the 3 different planes, so that's anatomy position. So that's basically what we consider the starting point for movements. So if there's a decrease of the joint angle, that assumes that anatomy guy, so that picture that we were looking at, that all of his joints are basically at 180 degrees, and that's the starting point. So when he moves doing flexion, so like for example, like we see in this picture, so this gal is moving her arm forward. So basically she's going from 180 at the bottom up to 90. So now her arm, straight out in front of her is at 90 degrees. And if she continued until her arm was directly over her head, that would be 0 degrees. So that's flexion. So movement resulting in a decrease of the joint angle. So again, it went from 180 to 90. And again, if she kept going, it would go to 0. Usually, so not always, but usually moving anteriorly. So remember, anterior is like toward the front of the body. So again, you can see like she started from 180 down there at the bottom, and she moved her arm in front of her, like toward the front of her body. So usually moving anteriorly in the sagittal plane. So the sagittal plane is the one that cuts the body into the left and right pieces. And I had said go ahead and take that sagittal plane, box over to the shoulder side. And so if you're doing walking arms, kind of like what this gal is doing here, so if you're doing that arm swing as if you're walking, so that's movement in the sagittal plane. Okay, but now it said usually. So usually we can use the word bending to describe flexion. So like for example, you probably know what it is to flex your elbow. So that would be to bend your elbow. So again, that would be like, so now if you picture her elbow stays by her side, she just moves her hand forward. Same thing. So movement resulting in a decrease of the joint angle. So now we'd be looking at the elbow instead of the shoulder. So her hand would start at 180 degrees, but then again, if you bend your elbow, then your hand is going forward, so anteriorly, and it's going from 180 degrees to 90, and then it would be 0 if you could, totally bend your arm all the way straight up and down. But I'm sure, like me, you have just, ginormous bicep muscles that are blocking you from bending up all the way. So you could never actually reach 0. But anyway, so that would be flexion of the elbow. So again, that's happening in the sagittal plane, and we're bending the elbow. So, okay, so a couple points to make about, again, this confusing definition. So usually moving anteriorly, because I know that you can bend your knee, but, so that would be knee flexion, but knee flexion does not happen anteriorly. It actually happens posteriorly. So if you're just standing and you bend your knee, so now your foot goes posteriorly. It goes toward the back of your body. joint angle. So you start, from 180, and then like if your knee, you move your foot back, so now your knee is at 90 degrees, so that's 90 degrees of flexion. And then again, if you could, have your your heel like touch your butt, that would basically be as close to zero as you can get. So that's bending your knee. So it's usually moving anteriorly, but not always, because definitely your knee is a big exception for that. Okay, so that's one point. So like your knee is definitely an outlier with that, because it's moving posteriorly. But then another one. So with bending, you can't always use the word bending for flexion, because, look at the gal in this picture here. So that's actually flexion of the shoulder. But would we ever call that bending her shoulder? Not really, although you could if you wanted. But that's shoulder flexion, so, moving her arm forward. Okay, so enough about flexion. So since we just covered flexion, hopefully we can do extension kind of a little faster, because it's basically just the opposite of flexion. So extension is movement resulting in an increase of the joint angle, usually moving posteriorly in the sagittal plane. So the picture we had before of the gal, just lifting her arm up to the front for flexion, so that, that was, shoulder flexion. So then basically the opposite, or bringing the arm back down, would be extension. Okay, so if you look, here on this picture, they have the arrow pointing forward, and that's flexion when the arm moves forward. And then when the arm moves backward, that's pointing at the arm kind of, in the back part of the person's body, it says extension. So technically, to kind of split hairs there, extension would stop right in the middle, when his arm is, directly in the middle of his body. And technically that's hyperextension if he goes past, again, so where it is actually, saying extension, they're behind him, that's technically hyperextension, but you get the idea. Okay, so when you do extension, you move with an increase of the joint angle. So if you had your arm straight out in front of you, like we had for shoulder flexion, so that again would be 90 degrees, so the actual shoulder joint is at 90 degrees. And you would increase, so then you'd be going back to that starting point, which is 180 degrees, so that's an increase of the joint angle. And it's usually moving posteriorly, so again, with the shoulder, you're moving back toward the back part of your body, so that's considered moving posteriorly. And again, in the sagittal plane, so again, if we had that, big box for a flat screen TV, and it was, kind of sitting, tall, right at your shoulder, moved off to the side there, so it's right about where your shoulder is. You're doing walking arms, so as your arms go back inside that box, that's movement in the sagittal plane, going posteriorly, so that would be considered extension. So again, it's usually moving posteriorly, and again, we'll use, the knee is that classic example where, that's why they say usually and not always, because when you extend your knee, or when you straighten your knee, it's moving anteriorly, so just the opposite of before. So flexing your knee is trying to kick your butt, and then straightening your leg back down, that is extension. So straightening your knee, that actually your foot is moving toward the front of your body, so that's the exception for extension. And again, you can use that word straightening most of the time to help you, to remember what extension is. Although, of course, if you're taking a test and I ask you to label, what movement is happening here, and you say straightening, that's not going to be the correct answer. You'd have to say extension. But again, you can use that word a lot of the time when you're describing extension. But again, at the shoulder, it's kind of like, what is straightening your shoulder? Nobody would really know what you're talking about. But that's what it is. It's just basically bringing your arm back down next to your body. If it were out front, it's straight out in front of you. Okay, so that's extension. Let's move on. Okay, 2 down, 4 to go. So abduction. When I was in college, my professor always made us say if she asked a question, is this abduction, or the next one is adduction, she would know if we were saying it correctly or not. We couldn't just, abduction, and, she'd be like, what did you say? So she would always have us say abduction, so that, if we say it out loud, she could tell what we were saying. But, okay, anyway, so abduction. So movement away from the midline of the body, usually in the frontal plane. So I'm just going to go ahead and, put that picture back up for us real fast here again. So usually in the frontal plane. So again, that's the pink one. So that's as if we had that, big screen TV box. We're basically standing in it and our arms can move, side to side inside that box. So abduction. So movement away from the midline of the body, usually in the frontal plane. So away from the midline of the body. So think of, if it'll help you remember, AB, meaning away, so abduction. You could, I actually, am stealing this from somebody else, but, so if you're abducted by aliens, it means that they're taking you away. So abduction, so moving away from the midline of the body. So instead of it being close to your body, you're moving it farther away. So like our gal here, who's holding on to the chair, she started from the midline of her body where her leg was really close to that, that exact midline of the body, and she's moving her leg away from it. And again, this is in the frontal plane, so if you picture she had that, box, that pink box, around her, she'd be moving inside that box, so inside the frontal plane. So that's abduction. Okay. So of course, if we had abduction or abduction going away, then of course we have adduction going toward. So that AD does actually mean going toward. So it's basically just the opposite of abduction. So again, when she was holding onto the chair, she lifted her leg up. That's abduction, it's moving away from the midline of the body. And then adduction is just moving toward the midline of the body. So you could think of it, it's adding to your body. So it's just, again, just the opposite of abduction. That's the movement away toward the midline. Adduction, moving back toward the midline of the body in that frontal plane. Okay, only two left. So, horizontal abduction, or movement away, is when you're moving away from the midline of the body in the transverse plane. Okay, just as a quick reminder, let me go ahead and bring that picture back up again. So the transverse plane is the one on the left, is the guy with the green box around him. So, and like I said, you can move that green box up to shoulder height. So, like I had said before, if he was doing like big claps with his arms straight in front of him, that would be movement in the transverse plane. Okay, so if you look at what this guy is doing here, so he's basically doing that same motion, right? I mean, can you see that? So he's basically doing like a big clap when he's doing these reverse flies, right? So I did purposely pick a bent over reverse fly because I do want to point out that, those planes move with you. So for example, just because, see, he bent over, so that is still movement in the transverse plane. So like, let me not confuse you, but if you, look back at those, planes again, the pictures, so, maybe you would say, well, wait a minute, is that movement in the frontal plane? Because that would be like moving, inside that box in the frontal plane. But no, it's not. It is still the transverse plane, because even if you bend over like that, the transverse plane moves with you, so it comes with you. So this is movement in the transverse plane, okay? Okay, so horizontal abduction, and you do, by the way, have to say horizontal abduction, because if you just say abduction, that's not correct, okay? Horizontal abduction is a different motion from the other one, whichever one I just said. A little brain fart. Okay, so movement away from the midline of the body in the transverse plane. So again, if you go back to my terrible example, with your arms straight, out in front of you. Horizontal abduction is when you're, like starting with your hands together out in front of you and then moving back. Okay. Again, exactly the same thing as doing a reverse fly, except maybe your elbows are a little bent. But so horizontal abduction, so an example would be like just basically opening your arms straight out back. Okay. So that's movement away from the midline of the body, because you started right at the midline of the body with your, if you have your hands touching in front of you, then that's right at the midline of the body. And then you open them up, so that's horizontal. Okay. All right, our last motion. So horizontal adduction. So movement toward the midline of the body in the transverse plane. So again, that flat box, if you can pretend like it's sort of like a tabletop, but we move it up to the man's shoulder height, then he can move his hand as if he's doing those big claps that I've been talking about. Here we have a picture of it, although this is from overhead, as if you're looking down at the top of somebody's head. So the horizontal adduction is that part where he's moving his hands toward each other, as if he had another hand here, and it was coming toward the other one. So that's horizontal adduction. So bringing that arm closer toward the midline of the body in that transverse plane. Again, if we had that box and it's up at his shoulder height, he could move his arm inside that box. So that's in the transverse plane, moving toward the midline of the body. Okay, so that's our last motions. Now we can go ahead and move on. Okay, now let's start putting this all together. Let's make it make sense, hopefully. Oh gosh. And let's have it mean something, so this information is actually valuable to you, so you can actually use it in your career or in your own exercise routine. Okay, so what is the main motion that the pectoralis major group does? So that muscle group, the pectoralis major, what motion does it want to do? Like if it could pick its favorite motion, what would it be? So out of all those motions that we talked about, so flexion, extension, abduction, adduction, horizontal abduction, and horizontal adduction, which one would it pick? So if we look at, so here's a bunch of exercises that I know work your pecs. So let's go ahead and just take a look at these. So can you see, if you look at the shoulder joint of each diagram here of each of the people doing these exercises, can you see that it's the same motion at the shoulder joint? So ignore the person's elbows. Your pecs don't care what's going on at your elbows, mostly. A little bit they do. But for the most part, your pecs couldn't care less what's happening at the elbows. So your pecs, basically attached going down your sternum, and then there's basically a whole lot of fibers that come, running straight out, and then they attach just beyond your shoulder, like onto your humerus. And I know I don't require anatomy for this class, and I think you'll be fine, even if you've had no anatomy. So your pecs are involved with motion at the shoulder because that's the joint that they cross. So your pecs do not cross your elbow, so they can't move your body at the elbow. I hope that makes sense. So like let's say you had no muscles on your body except for your pectoralis major. So could you move your elbow if that was the case? The answer is no. So you need those other muscles that cross the elbow joint in order to move that joint. So your pecs are involved with movement at the shoulder. So again, can you look at each of these and see that the same thing is happening at that shoulder joint? To make it a little bit easier, let's look at the standing cable fly. So that third exercise there on this drawing. So can you see, so he's basically standing there and doing a big clap, right? Like that big clap that I've been talking about here. And, pretty much is the exact same picture that we were just talking about in the last slide. For horizontal adduction, right? Same thing, right? So that is, basically the same motion that the person is doing in all four of those exercises they're doing. So you have to name first the joint. So it's shoulder, and then horizontal adduction, right? They're bringing their arms together in front in that transverse plane. So that's horizontal adduction, and it's happening at the shoulder. So we call it shoulder horizontal adduction. So now you know that anytime you see somebody doing shoulder horizontal adduction, you know that they're working their pecs. So if you want to make them stronger, more enduring, whatever the case might be, for that motion, you know what muscle group to work. You'll work their pecs. So one good example of that would be like somebody who plays tennis. So they're swinging a tennis racket. So pretty much any just regular good old tennis swing, that is a whole bunch of shoulder horizontal adduction. So if you want to help them be able to hit back even harder, really increase the speed of the ball, then you'd want to make their pecs stronger, and more powerful too. So again, hopefully this will all make sense, come together, and kind of, oh, that's why I care about this. So just a little asterisk. So I had said that for the most part your pecs could care less what's happening at the elbow. So the only way that motion at your elbow affects the shoulder is because, can you see that, like if somebody's doing the standing cable fly, so like look from where he's starting from, where the weight is and how far away it is from the body versus that flat bench. So the first picture there in that diagram, so the flat bench dumbbell press, can you see how much closer the dumbbells are to his body when he's starting? So the only difference with what's going on at the elbow is that when his elbows are straight, it's a longer lever arm. You remember that from physics? So it basically makes the weight heavier, especially at that position, that farther out position, that starting position. So so the movement at the elbow doesn't affect the shoulder or the pecs, except that it makes the weight a little bit heavier. So that's why, and you probably knew that. You probably knew, that you generally use less weight doing a fly than you would doing a dumbbell chest press. So that's, kind of the science, I guess, behind it, so that's the reason why. So it's just a longer lever arm. But otherwise, like I said, your pecs do shoulder horizontal adduction. Okay, let's try another one. So what muscle group does shoulder flexion? So here's that picture again from shoulder flexion. What does shoulder flexion look like? And so remember, shoulder flexion is that weird one where normally you can use the word bending for flexion, but it doesn't work at the shoulder because who on earth would call that bending your shoulder? So shoulder flexion again is in the sagittal plane. So it's sort of like the walking arms, when you're moving your arm forward. So it's going forward in front of you in that sagittal plane. So I know that before you started watching this video, if I asked you for a whole bunch of exercises that work your shoulders, you could come up with this one. So I know this exercise before, at least I assume so. So seeing this picture, what muscle group does that work? And I know you know it. It's the deltoid, so that that shoulder muscle. So now I want to kind of throw this one at you. So looking at doing this chest press exercise with those vertical handles. So you see how he's holding onto the vertical handles instead of the horizontal handles. So I always say it's it's black and white, and sometimes it's gray. So this is one of those where it is kind of gray. So this again is sort of like splitting hairs, being kind of nitpicky. But so if you are doing the chest press machine, so go ahead and sit there and try it in your room if you need to. But so imagine that person doing that chest press machine. So he starts with his elbows pretty much kind of close to his sides, right? And then extends his arms straight out to the front, right? So now remember from the last one that your pecs don't care what's happening at the elbows. So ignore your elbows. We don't care what's happening there. We're looking at the shoulder. So just look at person's shoulder or your own if you want to try doing this by yourself. So what's the shoulder, if you keep your elbows kind of close to your sides when you start and then press straight out, doesn't that kind of look like shoulder flexion? So that's pretty significantly different from doing, shoulder horizontal adduction, which you would certainly do more if you had your elbows up to start and you were holding onto those horizontal handles and then pressed forward, right? So using those horizontal handles are going to be a whole lot better if you want to target the pecs, and if you want to target your delts, it would be a whole lot better to hold on to those vertical handles. Now again, this is one of those cases where it's not quite black and white, it's a little gray. Your pecs actually do help a little bit when you do shoulder flexion stuff, but I really want to focus on the main muscle group, so the agonist, the primary mover for each of these motions. So, like when you do chest exercises, for example, so when you do shoulder horizontal adduction, your delts actually, especially the front part of your delt, if you want to be very specific, your delts actually help with that motion too. But again, I am working on, I just want to focus on the main movers, so just the primary movers, so that we don't get too confusing, because then we could be here all day and talk about, all kinds of muscles that are synergists or helpers or stabilizers and that kind of thing. So again, kind of making it more black and white, you could say that the vertical handles, the ones going up and down, are more of a shoulder or delt exercise, and the horizontal handles are more of a pec exercise. So just keep that in mind when you are, working with clients, with physical therapy patients, if that's what you end up doing. Oh, and speaking of physical therapy, so just a little sidebar. So if people have an injury like, such as rotator cuff, or maybe such as shoulder impingement syndrome, using those horizontal handles could actually create that impingement that causes them pain. So you might actually, if somebody does have a shoulder problem, want them to use those vertical handles, even if you're trying to focus on their pecs. And then you can say, well, at least, it's not black and white, it is a little gray. You do get a little bit of pecs when you do, those vertical handles. So if somebody has a shoulder problem, that might be your only option. And it's still, worth doing. Better than nothing, that's for sure. But keep in mind too, if you're doing a dumbbell chest press, you see a lot of people doing dumbbell chest presses like that too, where they start with their elbows kind of close and then go straight up. Again, without, a shoulder limitation, that's not the ideal way to do dumbbell chest press. It would be better to start, with their elbows open, like we had that previous picture, and, going up and together from that position. But again, that's being kind of nitpicky. So, and by the way, also keep in mind that variety is more effective than the most effective thing all the time. So even if you know the best possible way to work a muscle group, it doesn't mean that you should do it that way all the time. You should still mix it up. Okay, enough on that. extension, it would be a different angle, and definitely working different angles is great for your muscle groups to give them variety, within reason, of course. Or if you imagine like a low row, if you know what a low row is, again, shoulder extension is shoulder extension, shoulder extension. Just, again, just with different angles, just the resistance is coming from a different angle, and that will change how you work the muscle a little bit. But it's still doing the same motion. So it's still your lats doing shoulder extension. And so then also, so are close grip pull-ups. Same thing. It's a row, and it's basically just coming from a really high angle. But it's still, you're just basically bringing your arm back at the shoulder. So that is still shoulder extension, working your latissimus dorsi. So then, what muscle does shoulder adduction? So add is, coming together, going toward the midline of the body. So remember, shoulder abduction is like, taking away or lifting up to the side in that frontal plane. Shoulder adduction is that lowering part, so basically bringing your arm down towards your body. So what muscle group does that? And again, you might be sitting there thinking, I have no idea, but actually you do. So again, it doesn't matter what's happening at the elbow, except of course, like we talked about with the lever arm, that still applies. But anyway, so your elbows could bend while you do shoulder adduction, but that doesn't matter. We're asking what muscle does shoulder adduction. We're not asking what happens at the elbow. We don't care right now. So when you bring your arm down, and let's say you start from your arm straight, and then you bend it as you come down, I know you know what muscle group does that. And again, it's the latissimus dorsi. So the lats are kind of unusual in that way, in that they do two pretty distinctive movements, but it's the same muscle group. So like we haven't done this one yet, but your bicep, I bet you know what that one does. It bends your elbow, so it does elbow flexion. But pretty much that's about it. Of course, black and white until it's gray. Yes, it does other things too. But anyway, we'll ignore those. The main thing that your biceps do is basically just bend at the elbow. They do elbow flexion. That's primarily what they do. But your lats are kind of different because they are involved with two pretty distinctive movements. And that's because your shoulder joint it has so much motion there. That ball and socket jointed, and it has so much motion. So those muscles have to be able to handle all those motions. So yeah, your lats do both of these. So of course, if you're doing rows, and of course if you're doing lat pull downs, it's still working your lats, but again, differently, challenging that muscle differently, and the more variety you can get, the better it is. So, doing the wide grip, pull down or pull up, it's going to be, decently different from doing it close grip, so it would be good, to incorporate, one of each of those kinds or something like that in your workout program or for your clients, just to make sure you're working your lats as differently as you can. Okay, enough about your lats. Okay, so now, what motion does the posterior section of the deltoid like to do? So I know, before watching this video, if I said, hey, I want to work the back part of my delt, like that rear delt, what can I do to work it? I know you could probably come up with reverse flies. So this is the exact picture. Of course, this guy, if you're not familiar, this guy is doing reverse flies. And this is the exact picture that I used to talk about horizontal abduction, right? So you remember this? So basically moving away from the midline of the body in that transverse plane. So now all we need to do is come up with what joint did that motion, and I bet you can guess that it's at the shoulder. So shoulder horizontal abduction. So he's moving in the transverse plane. He's moving away from the midline of the body. So yeah, the back part of your delts, that's their favorite movement. They like to do shoulder horizontal abduction. Oh, okay, and then, so I like to make things black and white as much as I possibly can. But is it a little gray? Yes. Do your lats help with this? Yes. Are there other muscle groups back there, teres minor and picture, right, they're starting from 0, and then they have the person moving out to 90 degrees and then up to 180 degrees. See, so they're doing it the opposite way of, Anatomy Man, which I said it's actually kind of easier to do it, this way, the way this picture is showing, but that's not technically correct. So remember, flexion when you're moving forward is a decrease in the joint angle because you're starting at 180. So again, this picture is not technically correct. It's just this is so much easier to do, on a day-to-day basis. But that's not technically correct. So you should be starting at 180. But so abduction, remember, is in the frontal plane and moving away from your body. So basically just lifting your arms straight out to the side. So that's abduction, going from 180 to 90 degrees if you go, directly to shoulder height, just straight out to the side. So I know if I, gave you a pair of free weights, you held them in your hands and I said, okay, please lift your arms up out to the side, you know exactly what muscle group that is, or that's working. And that's your deltoid, so your shoulder muscle. So I know we're making this almost more confusing than it is. But again, at least if you ever see somebody, lifting their arm out to the side, okay, that's shoulder abduction. I know exactly what muscle group does that. That's the deltoid. So you can use that. And then, of course, if you're trying to make them stronger, more enduring, more powerful, you go ahead and work on the deltoid muscle. Okay, this one's going to be super easy. We're going to breeze through this one. So I know you know these, and in fact, I already gave you this first answer anyway. So what muscle group does elbow flexion? So again, bending at the elbow or, moving anteriorly, usually in the sagittal plane, decreasing the joint angle. So of course you know that there for number 7, that's the bicep muscle. So let's go ahead and move to the next one. So what motion does the tricep do? So you probably know your bicep, and then your tricep, again, if you haven't had anatomy, although you probably still know what your tricep is, so it's that muscle group, in the back of your upper arm. So what motion does your tricep do? So here's an example, and again, if I asked you before, hey, what's an exercise that I can do to work my tricep? Maybe this would be one of them. So these, are lying tricep extensions, or, kind of commonly called skull crushers. So you probably knew that this exercise works your tricep, and you probably know exactly what's happening. Again, probably without even watching this video, you probably could have come up with what's going on during this exercise. And so that's elbow extension. So you're basically straightening your elbow, or, kind of more officially, moving posteriorly in the sagittal plane. So these are both pretty easy. Okay, next one. So, what group of muscles do hip flexion? So, remember, flexion, again, is like bending, but again, at the hip, similar to the shoulder, it doesn't make sense to say, bending your hip if it's this, where you're basically standing up tall and lifting your legs straight out to the front. So that is hip flexion. So just like at a shoulder, it's the same motion, right? Can't you see, that, so if you're lifting your legs straight out to the front, it's just like lifting your arms straight out to the front. Remember, so that's shoulder flexion if you're doing it at the shoulder. So then at the hip, this is hip flexion. So bringing the leg, in the sagittal plane, decreasing the joint angle. Although again, see, they start at 0. Wrong. Try not to fall into that trap. But so they're, decreasing the joint angle, moving in the sagittal plane, moving anteriorly. So, what muscle groups do that? Or what group of muscles, I should say, do that? So, for this class, I would like the answer to be the hip flexors. Again, I don't know if you've taken anatomy, and I don't want to make this complicated and have you name all the little muscle groups, or the little muscles, I should say, that make up the hip flexors. So, to me, there's a picture for you if you're interested, but for me, for my class, the answer is the hip flexors. Let's keep it simple. Okay, so now this one. What motion do the hamstrings, gluteus maximus, and erector spinae do? So just in case you don't know, by the way, so hamstrings, are that big muscle group in the back of your thigh. Your gluteus simple as possible, I swear. You probably don't believe me, but I swear. Okay, so there is a motion that always involves these three muscle groups, and I know I keep, like, let's ignore these other muscle groups. Let's just focus on, the primary mover. But pretty much for this motion, those three are always going to be recruited in work. So basically the answer is, I'm just going to tell you, is hip extension. So remember, hip flexion is lifting your legs straight out to the front. Hip extension is basically just bringing it back. But yes, you can also do hip extension, meaning, so straightening, quote unquote, your hips. So that also is hip extension. So let's just go ahead and look at a few examples of this. So like the bridge exercise, for example, if you're familiar with that, so that is always going to work all three of those muscle groups. Again, so many different variations on this. So a deadlift, and this one being pictured here, that's like a Romanian deadlift, if you're familiar with that. If not, no big deal. But so she does slightly bend her knees doing this version of the deadlift. Or there's, straight leg deadlifts where you basically keep your knees straight, you just bend over, but keeping your hips back as far as you possibly can. That's kind of the key to a deadlift. And basically if you don't, basically stick your hips back as far as you can, then that turns into this exercise, which is that's kind of commonly referred to as a good morning. So again, all of these are examples of hip extension, and all of them work all three of those muscle groups. But, look at them. If you're familiar with these, you probably know that, yes, you absolutely can emphasize one of the muscle groups over another. So, think about the difference between, like, a good morning and a Romanian deadlift. So, if you're not familiar with those good mornings, those work your low back, so those erector spinae a lot. Whereas, like, the Romanian deadlift, that's going to work, kind of more into the hamstrings versus the good morning. But again, they're all working all three. So it is important to note that, so first of all, you are only as strong as your weakest link. So yes, we do want to, make sure that our low back muscles are in good shape, but remember, they're not really made to be all that strong. We really need to, work on their endurance, even more so. So just keep that in mind, that yes, doing core exercises basically is my point. Make sure to strengthen your core, to protect yourself. So again, all these are different versions of hip extension, and so anytime if I ask, like, what muscle, group, maybe with S, in parentheses, does hip extension, the answer would actually be hamstrings, gluteus maximus, and erector spinae. Alright, these will be easy. What motion does the quadricep muscle do? So that's the front of your thigh. And I've got the machine pictured there. I'm sure you felt the burn if you've ever done that exercise. You know exactly what muscle group that's working. So what's happening during this exercise, what motion is happening, and you can probably tell. So it's knee extension. So you're straightening your knee. So yeah, one's pretty simple. So the quadricep does knee extension. And then, so conversely, it's not going to be too hard to guess, what motion does the hamstring do? And so again, that's the back of your thigh. And so that is just the opposite, so knee flexion, so basically bending at the knee. So to really isolate the hamstring, I know we talked about the hamstring is involved in hip extension, but just isolating the hamstring, that would be, basically any kind of a leg curl machine, or anything where you're bending at the knee. So it does knee flexion. Alright, I want to kind of breeze through this slide. So, what motion does the rectus abdominis do? So hopefully you're familiar with that. That's your, that main So if you think of sit-ups, or crunches, that kind of thing. So that's flexion happening at the trunk. So moving forward, and again, it doesn't matter if you lay down, the planes move with you. So it's trunk flexion. But for the most part, especially with functional fitness and trying to prevent injury, we're not going to talk much about motion, at the trunk or at the core region. We really want stabilization. We want our rectus abdominis to be really good at stabilizing that, preventing motion, if anything. So yeah, we won't talk much about trunk flexion, but I do want you to be aware of that, because we'll bring things like this up and off of this slide when people are compensating basically when they're moving improperly. Okay, so what motion does the erector spinae do? And again, we talked about they're involved with hip extension, but again, isolating the erector spinae, those low back muscles, so they do trunk extension. So if you're familiar, like with maybe like a cobra in yoga, or so basically just like straightening at the trunk. But again, we really want our erector spinae to be very enduring and to stabilize our core and hold our body still in that area while other things are going on with our appendages. Okay, what muscle group does trunk lateral flexion? And so we didn't even talk about that as a motion, and I don't really want to focus on it much, because again, we don't technically even want people doing these motions if we can avoid it. So the answer there are the obliques. So we're kind of talking, if you know those, right on the side of your waist, so like the love handle area, basically. Okay, and then what muscle group does trunk rotation? Again, we didn't talk about rotation as a motion, but that's okay. You can certainly handle this. So, if you're rotating at your trunk, I bet you know what does that, and that's, again, those obliques. So yeah, just kind of running through that. Alright, yay, we survived going through all those different motions. Yay, okay. Before I can let you go, I have to go over a couple of very important points. At least I think these are very important. So I did hopefully help you as far as analyzing motions and then being able to make people more fit, again, stronger, powerful, enduring, whatever, in all these different motions. So I want you to be able to go out and analyze motions and then be able to use that. But I think you would possibly get kind of confused if I didn't go over this important part. Okay, so the muscle group that works on the way up is the same muscle group that works on the way down. So what I mean is, let's think about negatives. If you've ever seen somebody do negatives, or if you've ever done them yourself, they're just a great example of this. Okay, if you're not familiar with negatives, I don't want to embed video and, it just takes you too much time. I'd probably screw it up anyway. But okay, so a negative is where, if you can imagine somebody doing like bicep curls, with a bar, so like barbell bicep curls, and they put so much weight on it that they actually can't lift it, like they can't do a bicep curl with it because there's so much weight on the bar. So somebody else is there, and they actually help the person, lift the bar, so actually do the, bicep curl. And then what they do, so the other person lets go, and then the person working basically tries to resist, that bar. So of course they want to just drop it. So they basically try to lower it as slowly as they possibly can. So they lower it slowly, and then they hit the bottom, and then the person, again, grabs onto the bar, helps them lift it back up, and then they slowly lower. Okay, so those are negatives. So the muscle group that works on the way down is the same muscle group that works, on the way up. So let's say you were analyzing that motion. So you go to the gym, you're watching people do negatives. So now wouldn't you look at that and say, okay, what's going on during that motion? Okay, they're straightening their arm. So doesn't straightening your arm work your tricep? Isn't that a tricep extension? But if you've ever done negatives and you were doing bicep curl negatives, what's sore the next day? It is certainly not your tricep, right? It's your bicep. Oh my gosh, and by the way, negatives can really get you sore. Okay, so why is that? How come you're staring at somebody doing, basically an arm extension and it's working the bicep? Well, here's the answer. So the answer is because they're basically doing what's called an isotonic contraction, which, we won't get into that. There's basically like 3 different kinds. There's isometric, which is like a wall sit, so the length of the muscle stays the same. So you're basically like, just holding a position for a certain amount of time. And then there's isokinetic, which means that the speed stays the same. So you barely ever see that, maybe just at like physical therapy. So the resistance would either increase or decrease to control the speed. So if the physical therapist wants you to move really fast, then the resistance will be kind of light. And then if you end up going too fast, then they'll put some more resistance on it. But anyway, so that's isokinetic. So this is isonic, which basically means it's supposed to mean that the tone or the resistance stays the same, which is not technically the case. If you ever go into this and study how lever arms work and the arcs and stuff like that in movements, it's not technically the same. But so the weight, we can just keep this simple. The weight stays the same, right, throughout. If you're using dumbbells, it's 25 pounds or whatever the case might be, right? Okay, we'll keep it simple, even though it's not technically true. Okay, anyway, so there are 2 parts to that contraction. There's the concentric, which is where a muscle produces a force as it shortens. So that's the way up on the bicep curl. And so we know that that's elbow flexion, that's working the bicep. And then there's also the eccentric part of this contraction, and that's while the muscle's producing a force while it's being lengthened. So that's the slow lowering part of the bicep curl. So the whole time, the way up, the way down, you're working your bicep. Okay, it's not your tricep on the way down, it's your bicep. Your bicep is slowly lowering, so it's resisting, wanting to just drop the bar. So that is a part of, the contraction, and by the way, a very valuable part. In fact, a lot of people say that might even be more important for things like bodybuilding, to do the eccentric part versus the concentric. So try not to just drop, the weights, if that's what your goal is when you're doing resistance training. But okay, so does that clear that up? So if you're looking at somebody, make sure that you understand, which direction is the actual resistance. So, again, like you could look at a squat. So if somebody's doing a squat, which way is the hard part, basically? And that's the way up, right? So that's where you're resisting the resistance, which is gravity. So on the way up is the hard part. So what happens on the way up? So you could probably analyze this now, right? So you extend your knees and you extend your hips, right, on the way up. So when you extend your knees, that's your quads, right? And then when you extend your hips, that's the one, so the hip extension, that's the one that has the 3, so the glutes, the hamstrings, and the low back. So, when you're going up, doing a squat, so you'll work your quads, and then the 3, the hamstrings, the low back, and the glutes. And on the way down, it's that slowly lowering, it's the eccentric part of the contraction. So you wouldn't say when you're doing a squat, I know that we have to work their hamstring because they're bending their knees on the way down. Well, that's not the case. I mean, you need to strengthen the hamstrings so that they can extend, do that hip extension while they're doing a squat. So I hope that kind of helps also. Hopefully this will make more sense, especially so start watching people and start seeing, what movements are they doing, and then see if you can figure out, what's the important part, what's the concentric, what's the eccentric part. So that can kind of be a little bit tricky when you're learning to analyze motions, but I'm serious. If you practice it, you will get it, and it's one of those things where once you get it, you are good to go. It's like riding a bike. You'll pretty much never forget. Last little point that I want to make is this one. So make sure that the resistance is being directed properly. So now you know how to analyze motions. So let's say that you work with somebody and you're trying to strengthen their rotator cuff. And okay, we didn't talk about shoulder rotation, but there's internal and external rotation at the shoulder. So a lot of people do this where they basically, go to physical therapy and the physical therapist trying to strengthen their rotator cuff. Let's say they had a partial tear or something like that. They'll have them use the cables or something like that. describe in order to work with free weights. So free weights always have to go up and down in order for them to work. So basically what this guy is doing here is he's doing an isometric contraction of the bicep. So remember, I kind of just whizzed through that real fast. So there's three kinds of contractions. So there's isometric, I said was like a wall sit, so the length of the muscle stays the same through the contraction. You basically just hold it. So we don't do isometric contractions for most of our resistance training because it's just not as valuable as doing isotonic, which again, that's the one that has the concentric and eccentric, so the lifting it up, lowering it down, lifting it up, lowering it down. So the isotonic will get you strong through that whole range of motion. So if you do an isometric, something like a wall sit, so you'll get your leg muscles nice and strong right in that exact position, so right at that muscle length. So a lot of catchers in baseball or softball will do tons of wall sits, but unfortunately they're doing it basically they're usually told like, oh, make sure that your hips and your knees are right at 90 degrees, and then you go you just sit against the wall, you just hold it there in that position with hips and knees at 90 degrees. But then they go out onto the baseball field and they get into a squat, a much deeper squat, and sadly there's really not much carryover. You only make your muscles strong in that one position when you do isometric contractions. So they're not really all that valuable for strengthening motions. But now, keep in mind, that is not saying that doing things like planks are not valuable, because, oh, yes, they are. Planks are wonderful. They are isometric contractions. So you're basically, you're staying in that one position, holding it there, and you're making your body strong. So you absolutely should have good form, have very good posture when you're doing things like planks. But that's exactly what you want to do. You want to make your body as strong as possible in that good posture, and then it will carry over into, as long as you're holding that same posture when you're doing other exercises or doing your activities of daily living throughout the day. So back to our guy here, dumbest exercise ever. Or a lot of times you'll see people do, especially in group exercise classes, not to rip on anybody in there, but a lot of times you'll see people holding free weights in their arms, and then they put their arms into like pec deck position, if you're familiar with that. So if you imagine just basically lifting your arms straight up, so your upper arm is basically going straight out from you in shoulder flexion, but then you bend your arm up, so like your elbow is now also at 90 degrees, your weights are kind of going up toward your head, and then they basically like open and close their elbows. So they're doing shoulder horizontal abduction, kind of mimicking a pec deck machine. Again, that's an isometric contraction of the deltoid. You are not at all working your pecs, even though they think they are, doing that exercise, because your pecs, are not resisting that motion. Your delts are holding it up. So that's another exercise. Please don't ever do that. So what this guy could do is, do what this picture is doing, with this gal. So she, turned her body so that now the resistance is in the right direction. So now she's lifting the weight up and down while she's doing that, and that will in fact work her rotator cuff and help, make that stronger, more enduring. So yeah, please be aware of that too. Make sure that the resistance is being applied properly against the motion that you are trying to work. Yay, that's it. We've made it. Yay. So I hope that wasn't too awful. Thank you for your patience.